1, 2, 3. It's difficult, right? When you're looking at the other person, it's like harder. Hi, my name is Aslan Emerov, and this is Small Pharma Talks, where we give you the inside scoop on all things pharma. Today I have a PharmD who has worked in many different fields in both hospital, clinical, and retail pharmacy, Dr. Mina Soliman.
Thank you for having me.
Are you satisfied with being a pharmacist?
Honestly, after a year and a half of being a pharmacist and going through school and doing my EPIs in hospital, I see that pharmacists are underappreciated in a way that we're not getting enough financial incentives for the amount of work that we're doing. We work a lot of hours. We do a lot for the setting that we're working in, whether it's a hospital setting, industry, retail, community. We work a lot. Even if you own your own pharmacy, you clock in a lot of hours to get that business up and running and to make sure you're making money at the end of the year, because a business at the end of the day is all about money. So because many of us are not getting enough money and enough incentive for the work that we put in, we're not satisfied. During COVID, I worked in a hospital and I also worked retail. We were putting in so many hours. We had so many call outs because whenever a person felt sick or achy, they just call out and they quarantine for 14 days, even though we don't know if they were COVID positive or not. And a result of that, the people that were fine, they were working crazy hours in hospitals. So were we getting enough money? We didn't even get hazard pay. Many pharmacists didn't even get hazard pay. That's one thing.
Can you explain what hazard pay is to the camera, to the people that don't know?
Hazard pay is basically when you work through crisis and you put in hours, they pay you a financial incentive for on top of your regular salary for working through the crisis, basically. A lot of hospitals in New York State didn't get the incentive. One of these hospitals was the hospital I was working at, and we didn't get hazard pay, but we still worked.
Yeah.
We still cared for the patient. We still went to work every day in the morning, and we did what we do.
That's absolutely terrible. Do you think that considering all of the stuff that you're doing for the patients, no hazard pay, you're going through hard hours during this COVID pandemic especially, considering you have double the patients, you're administering vaccines now, all the schooling you went through including rotations and everything, the public perception of the pharmacist is still somebody that just fills pills?
Yeah, and this comes from somewhere above. There was a person in the government, Chuck Schumer. He called us. He was classifying pharmacists in a way. It wasn't too direct in his tweet. He called us. He put us right next to grocery workers. If you guys go back and look it up, you'll find it. Yep.
That's terrible. Grocery workers?
Yeah. He was classifying the medical professionals, nurses, doctors, frontliners, all of these good people. And I'm not saying they weren't doing work, but then we're also the pharmacy is a frontliner. They didn't put us with them. They put us with another category with restaurant workers, grocery workers. You're talking about hundreds and thousands of pharmacists that are working in this country through the pandemic, making sure that whatever medication is out there treating these people gets to them, because without the pharmacist it's not gonna go. Just as simple as that. These are the rules. Without a pharmacist, you can't have medications get to the patient, whether it's getting to the bed in the hospital or getting to them in the outpatient setting, whether delivering or the patient is picking up or all these easy things.
Definitely, considering the supply chain going down from the doctor and the hospitals down, if the pharmacist isn't involved, that's it. The entire country collapses. Which is actually kind of funny, because I've been hearing all of my other friends that do work at grocery stores and whatnot, they actually were paid hazard pay, Meanwhile, people that were actually dealing with these people that may have COVID, you never know if somebody comes in. Sometimes people even come in asking the question, like, they have symptoms. They don't go to their doctor first. They feel like the pharmacist is the most easily accessible healthcare professional. They come to you, they ask, and then yet you're there. You have no protections against anything. You have no hazard pay. And what are you to do in that situation other than, like, I don't know, make some laws or get some social status for pharmacists?
We can't turn patients away. We signed up for this. When we had our oath, we swore that we're gonna take care of every patient we get, and we're gonna be very faithful in what we do and very ethical. And many of the pharmacists, including myself, we feel like we're obligated to do this. We feel like, okay, we're just doing it because this is what's good for the public. We signed up for it. We're gonna do it regardless of the incentive, regardless of what the corporate world think about us. Because some of the corporates, and not all, but some are just pressuring pharmacists, especially the new pharmacists, to feel like they're less than what they actually are, and that actually shows in their paycheck. If they don't see you as a very critical part of the medical wheel, they wouldn't be thinking about you that way. They wouldn't be, they wouldn't wanna not pay you enough. They wouldn't wanna pressure you into doing things that you're not supposed to do. Or maybe you can't do because it's physically impossible. Today I was talking to one of my coworkers. We had a vaccine clinic, and he was telling me that he was working for a specific corporate, and he was working with me, and then that corporate bought some of our stores, and they took over his store, and he became working for another chain. And then when he started working for them, the system is completely different. The hours are completely different. The patients are doubled because they started closing their own stores and pouring over all of these pharmacies into one pharmacy, and he still had the same amount of help.
Yeah, that makes absolutely no sense.
Exactly. So, and when he talked to them, they told him, well, that's not that much work. We have pharmacists working for the company doing same amount of work and they're still alive. So why are you complaining?
Yeah. You actually mentioned about paychecks earlier, that the paycheck for pharmacists was going down.
Yeah.
So I remember talking to a few pharmacists in, like, my recent experience. They talked about a golden age of pharmacy when people were getting signing bonuses to actually go to these different locations. And now it feels like we're actually doing double the work because pharmacists have had to learn how to do immunizations. They're doing twice the amount of work, but they're getting paid less and less consistently. What are your thoughts on that?
Back to the same person I was talking to.
Yeah.
He was one of those people who actually signed up in the golden age. He when we talked about it, like, before in the past, he was like, they used to pay us. They used to want him to go to the Hamptons every summer. They pay him his salary plus transportation plus the bonus plus hotels for the whole summer in the Hamptons, and he can log in whatever hours he wants. Why? Because they need him. But once they stop needing you, they drop you.
Why do you think this sudden shift of all these, like, Hampton lifestyle, clocking in at your own hours, why do you think it's going downhill? It's not the same now.
Because pharmacy schools are producing way too many pharmacists. They saw the demand back then, and they just started opening up pharmacy schools. Up to 2013, I believe, and correct me if I'm wrong, there was only three pharmacy schools in New York and New Jersey. There was Long Island University, St. John's University, and Rutgers University.
Yeah.
Right? Then, after that, I believe 2012, they had Toro opening up a pharmacy school. They had FDU New Jersey opening up a pharmacy school. They have Albany in upstate with a lot of students. So you have all these schools starting producing students about 700-800 a year, where the market doesn't really need that much anymore because you filled it throughout the years before. Many people came from other states, right? And they filled the market. The market became very saturated to a point we don't have positions for them. So what companies started doing, fire the people with the high pay and hire people with lower pay.
Like the new incoming students and
Yep.
whatnot, right?
And because you're new, you don't have experience, you have all of these requirements for you to get a good incentive on what you do. So what you do, you say yes. Sure, I'll take it. For $45, $42, $40, I'll take it.
Oversaturation was actually one of the biggest problems that I had when I was first going into pharmacy school. What do you think are some niche fields for pharmacists that for pharmacy students that are in school right now that they can go into in hopes of not being a retail pharmacist, not taking this absurd amount of work for a low amount of pay? What do you think are some good alternatives that they can do with their pharmacy degree?
Okay, so first of all, I want to start off with something. There's nothing wrong with retail pharmacy. I love retail pharmacy. I did clinical pharmacy for a year, but then I went back to retail. Why? And I still work for a hospital too, but just I work for the hospital part-time and I love doing retail. I feel like I can make more of a difference in the retail setting. I see more patients, I have more direct interactions. In a hospital you're more limited. So there is really nothing wrong with retail pharmacists, and it's a big job and it's a big opportunity for whoever really wants to make a difference. But other fields that students can go into and not be pressured into being a retail pharmacy, because retail pharmacy is really the only option out there because it's so hard to get into other fields. I see that if students start getting secondary degree next to their pharmacy degree, there are many opportunities would be open. Let's talk about MBA, Masters of Business Administration. There are many fields in that. Marketing, you can work for industry. There are public health, Masters of Public Health, MPH. That's also a big field. You can work administration and hospital administration, and they're looking for pharmacists. But it's just we're not trained enough to be directors and administrators in hospitals during school, so we really need that experience from a Masters in Public Health. There is a huge field that's coming out right now. We're in a world that is built up on top of data. We have tons and tons and tons of data, millions of gigabytes and terabytes, and we need some people to analyze that data. So there is a new field. It's not new, it's fairly new. It's called informatics. Informatics is a huge field. I recommend every pharmacist who's looking to grow in the pharmacy field to get a degree in informatics, because that's the future. You need to know how to look at data, you need to know how to read data, you need to know how to analyze it, and you need to know how to utilize it. This is critical for every pharmacist, even retail pharmacists. If you become a store manager or a pharmacy manager, PIC, you need to look at these charts, these Excel sheets, these pie charts, and see if you're really making profit. No, because at the end of the day, it's a business. So you have to read your numbers. You have to read your inventory numbers. This is all data that you have to learn how to analyze, how to utilize it to improve your business. So informatics is a big thing. I recommend everyone to at least have one class in informatics. I know some schools are offering it now. Long Island University, I was the first class that they offered the informatics class for. But if you get an actual degree in informatics, I know a lot of pharmacists that are going back to school and getting informatics degree. So it's a huge field. I recommend everyone should explore it.
Do you think that informatics is the field the right field for pharmacists when there's other like majors such as computer science and analyzing all this data that are doing the same thing? Why should pharmacy students be the ones that to analyze the pharmacy data rather than some person that doesn't know anything about pharmacy, but they know how to make like machines that sift through it?
It all goes back to clinical. Right now, what they have is actually a lot of non-pharmacists that are doing this work, right? But the problem is when they're doing it, in the background, it creates a lot of discrepancies and errors. And in the computer science world, we call it bugs, right? So when you have bugs in a system, let's say you went to school for informatics, but you were never a pharmacist. When you go through the process of order verification for medication or building a formulary for a hospital, that takes a lot of clinical knowledge and critical thinking in how the pharmacist that's verifying the order gonna see how he's got the order and how is he gonna verify it to get to the patient fast. So creating that process, you still need someone who practiced it, knows what's important and what's not important, so you don't incorporate basically useless tools and useless information in the end point on the pharmacist side, not on their side. They can do a lot of things with the information that they have, but clinically they can't do it much because they don't have the clinical experience.
Yeah, definitely. I feel like pharmacy students, the ones that have actual practice in the field, who are used to using these systems, used to using these computers, they would definitely know the best way to make a user interface that is actually pharmacist friendly, not just a bunch of data thrown out their way.
Right.
Compared to retail pharmacy, which I have a little bit of experience in, everybody that's in pharmacy school right now has retail experience. They're like technicians, you know.
Most.
Yeah. What is the difference in like how you're perceived while you work in a retail environment versus a hospital setting?
So first of all, there is a huge flaws in the system and the environment that retail pharmacists work in. We don't call ourselves doctors, and we don't call each other doctors.
Yeah.
If you noticed, when I work, I called my coworker, the other pharmacist, I call them doctor. Because let's bring them to the place where they really belong. At the end of the day, we're doctors. We graduated on... The last time they called me a doctor before I went to a hospital, it was on graduation day. They said, Dr. Mina Soliman. That's it. That's the last time I heard doctor. And then I worked retail up until I went to a hospital and I started slightly hearing it again.
Yeah.
And that's not good. We're not seen as doctors. We're not seen as important medical professionals, providers. We have an MPI. We're a provider. When I work in a COVID clinic in a hospital, I'm the only provider in that clinic. There is no nurse practitioner. There is no doctor. There's no PA. I'm the only provider. If something happened to the 40 patients that I get every hour, if something happens to them, it's on me. Because I'm there. Yeah, there is a chain of command and there's all of that and there's names and protocols, sure. But at the end of the day, who's on site?
Yeah.
So they see us in the hospitals, they respect us more. But in retail pharmacy, they don't see us as doctors, they don't respect us. It all goes back to the point of they see us as grocery workers. We ring up diapers.
Yeah. It's actually kind of funny too, because when you see a pharmacist in a hospital environment, people are actually more likely to confuse you for being like a doctor in the sense of being like a physician practitioner, right?
You want to hear something funny?
Yeah.
It all comes to the white coat.
The white coat, yeah, it's all the white coat.
If your white coat is long, you're a doctor. If your white coat is short, you're another professional or a student, right? In retail pharmacy, for some reason, I believe convenience reason, maybe, all the white coats are short.
Yeah.
Made by corporates. All major corporate pharmacy, like chain pharmacies, are all their white coats are short. And it's not a big of a deal. But the way people see you makes a difference. If they see that white coat, oh, that's Dr. So-and-so.
Those 2 extra inches make a big difference,
They
right?
make a big difference.
So you were actually one of the first people in charge of giving out the vaccines at a New York City hospital. One of the first people to do it at all. You had no training, no experience. They just dropped it on you. Can you tell us your experience, how you managed to work your way through this?
So we were given the information that the manufacturers gave us, right? And given that information, we had the fridge few days before we were told we're gonna get the vaccine. We had the fridge set up, the super freezer, and it was all ready to go. And then we got the vaccine, and on that day they told us tomorrow we're gonna start vaccinating.
They didn't give you any other warnings beforehand. Not a week, just one day.
No training, nothing. Just one day, got the handouts. And then with these handouts, we started reading, we started knowing about it. And then the morning of, we took the first few vaccines, we took it to the hood. And we mixed it in the hood and IV room. And just, this is how it all started. We mixed it, we saw it, we first started giving it to staff members. And a lot of people were skeptical about it.
Yeah, of course, yeah.
But we got it, and with the information that we were giving, we just worked with it. In the beginning, they were saying, oh, it's only stable for 1 hour outside of the fridge. And then it became 2 hours, then it became 6 hours if you puncture it. And if you mix it, it's 6 hours. And every day the information was changing. And every day the information was changing, and when they were changing, we started adjusting the workflow based on these changes. Up until last week, Pfizer came out and said, "Oh, the vaccine is actually stable in a regular freezer, Pfizer vaccine, for 2 weeks in a regular freezer. It doesn't have to be a super freezer anymore." So we can actually put it in a regular freezer for 2 weeks at a regular freezer temperature, -4 degrees. So why not? So a lot of companies started getting Pfizer. Chain pharmacies are giving Pfizer. I was given Pfizer at a chain pharmacy today.
Yeah, Pfizer I feel like are just the best fridge salesmen in the world. First they make their vaccine. They say that it needs to be in the super fridge that they happen to sell as well. Then everybody buys it, and then afterwards...
It was about $36,000.
$36,000 just for one.
One fridge.
And that's, keep in mind, you keep multiple fridges, I'm assuming, in a hospital, or just one to keep it?
If it's a small hospital, you need one. If it's a big hospital, I believe Bellevue had a couple of super freezers.
So, how many patient interactions do you have a day? Would you prefer more or less, or is there a middle ground where you don't have to speak to, let's say, 200 patients for a second each, rather than 50 patients, but you get to actually give them beneficial information about the medication they're taking and actually counsel them, versus just tell them, oh, here you go, read the label, and then leave?
You can't really set a number, because it depends on where you work. Sometimes you need more time with every case, with every patient. Sometimes you can just it's a refill for a vitamin. Not saying that it's not important. You can just give it, let the patient know that it's the refill on their vitamin. That's it. So you don't need that 5-10 minute interaction. I'll tell you a funny thing. I was doing rotations at a managed care plan, managed care setting, one of the biggest, actually the biggest in New York State. And I'm not gonna mention the name, of course, but they were mandating the pharmacists to do, not mandating, but they were looking for pharmacists that are fast enough to do a prior authorization every 7 minutes. So the record they want that pharmacist to review the patient case with whatever information that's giving, if they have an appeal on a prior authorization for a certain medication, and everything about him, that's including very critical information that you may get from the provider telling you that this medication is very important, and you have to review that in 7 minutes.
Do you feel that actually these companies setting up a time frame for you to do it in, like, makes it more easy to make errors in the process? Like, obviously, if a pharmacist has 7 minutes to do something and they're told, if you can't do it in 7 minutes, you're out, they're obviously going to start making more errors and whatnot. What do you think should be a good middle ground between pace and actually putting in the work?
Training.
Training?
It all comes with training. That's the middle ground. You can have a super fast pharmacist doing that much work, do it in 7 minutes, maybe less on average, because they were trained well, they're knowledgeable. So all these numbers can be possible. They pressure the new people in the team. They pressure them a lot, and they can make mistakes. So it depends on the setting whether the mistake is critical or not. You can't make a mistake like that in a clinical field. For example, if you're a clinical pharmacist working in a critical care setting, let's say you have 20 patients a day. You're only seeing those 20 patients, right? But these 20 patients, you have to go in depth with every single thing that they're doing. So every single little details matters. Their levels, their labs, even their signs and symptoms when they're taking medications, vented or not. Many different aspects that come into place that a pharmacist have to look at. So it really takes you a lot of time for that one patient. So the number of patients doesn't really matter, but the quality of work that you're producing is what matters.
Mm-hmm.
So with having a quota that you have to meet, or a time frame, or a time or a time on every single task that you're doing, gonna affect the quality of work that you're producing, I think it's a big thing, and they should look into it.
Yeah. You mentioned before Chuck Schumer's tweet on putting out pharmacists at the same level as grocery workers.
Yeah.
And with a lot of pharmacy chains actually opening up literal drive-through windows for people to just pick up their medications, do you think that this further devalues the role of a pharmacist? Now they're seen as literally like a McDonald's or fast food chain.
It's a funny one because my fiance was working on a drive-through chain. She's a pharmacist also. She used to hate it because it just, you have the phones ringing, you have the drive-through, and people are yelling at you from the drive-through like they own the pharmacy.
Yeah.
Why is that happening? And it all goes back to depreciating the pharmacists. That we're underappreciated. We're not seen that way by the patient. We're making all of these things to make it convenient for the patient.
Mm-hmm.
But the patient is underappreciating it, so is the chain.
Yeah, and I feel like these patients become entitled to the services that you produce.
Exactly.
Because if you think about it, maybe like 10 years ago, almost no pharmacy even delivered medications. You had to go in there, you had to pick it up. Now people start delivering, they start doing drive-through chains. Now if your pharmacy doesn't have that...
DoorDash too.
DoorDash, yeah. Can you imagine DoorDash? Literally, a person that knows nothing about the person's medication comes in, grabs medicine that could be life-saving, then they ring the doorbell, forget to get a signature, no confirmation that the patient has received the medicine, and then they just let it go.
It's very sad where we became and where the field is heading to. Unfortunately, they're just seeing us as regular convenience store workers, where we just have to do everything to make it convenient for the patient so we have more sales, which is not right, because at the end of the day it's clinical work. Now CMS is pressuring the pharmacies to do all of these semi-clinical tasks like MTMs, medication therapy managements, but they're useless. Forgive me. It's a useless system where you're just forcing the pharmacy to do things and adding work in their day that they don't even have the time to do.
Definitely.
And you're just pressuring them and telling them you have to do this and you have to do that. It's not right to put all this workload on one pharmacist. CMS might have a case and say, oh, it's up to the chains to do it, to give you more staff. But what if the chain doesn't give you the staff? What if your staff is out sick on COVID, somebody died, and someone have to do the work.
Yeah.
Someone have to do the work, and that someone have to be trained, and that someone have to be able to deliver the message correctly, and that someone have to care for this patient.
Yeah. Considering all of this is happening and the trajectory that pharmacy is going, where do you think the pharmacy industry is going to be in 10 years?
I'm not gonna say the cliche
Yeah.
thing, robots. No, we're gonna continue on, just try to become make everything automated. Automation is gonna take over a lot. A lot of these pharmacies are gonna start doing work from home. They already do, but you're gonna have someone doing work from a desk or from home, and a machine doing the rest of the work. Yeah, you will have technicians and you'll have all of that, but it's going less and less and less and less, because technology is making it much more easier and convenient for the pharmacist to perform certain tasks. Think about robots and pharmacies. You have some robots, you get the prescription, you verify the order, and that robot basically takes a vial with a robotic arm, brings it to the cell, counts the medication, pours it, label it, it comes out to you, just ready to go. All you need to do is to cap it, check it, send it out. So how long is it going to take you? Very minimum time, because you have the robot helping. But in 10 years, I don't see robots taking over. I would say in 20 years, but 10 years, highly unlikely. I don't see robots taking over clinical work, work that require thinking and work that require judgment, because you can have, all goes back to the data. You can have a lot of data given to you, but you need someone to analyze it and to make a decision for that data that's given to you, whether that data is labs and x-rays and values and all of that, or if it's analysis, number of patients and how much money you have to make. Someone have to make the decision, so you need the pharmacist to do that.
Do you think that there's anything that pharmacists can do right now to raise their reputation in the medical field, to have people going back to referring to them as doctors? Where do you think it all starts, where we as pharmacists can actually make a change to make ourselves more respectable?
First of all, we have to start with ourselves. Everybody, we have to see ourselves as doctors. When I talk with my fellow co-workers in the hospital, let's say they're from nursing, PAs, nurse practitioners, they refer to me as Dr. Soliman, and I also, whenever I talk to them on the phone, oh, this is Dr. Soliman. I try my best to make them see what I do and get a feel as, yeah, I'm a provider, I'm a doctor, but doctor in my field, doctor of pharmacy. So when you go and call yourself a doctor, they automatically think you're MD, medical doctor. But what about pharmacy? What about other fields, right? So doctor should be something that should be a word that's being said regularly. And if we start with ourselves, I call you when you graduate doctor, you call me doctor, we call each other in the pharmacy doctors, we make our technicians call us doctors. I'm not saying force it, and I'm not saying to be stuck up, but I'm saying to give you the respect that you really deserve and what you earned. You earned that title. You worked so hard for it and you earned it. So it's very important to have the society see us as doctors. Doctors in our fields. It's great. I had a patient today I'm vaccinating. This is something good and sad at the same time. They're foreigners. I believe they're from India, Punjabi. And I noticed that in their communities, the pharmacist to them is a doctor. They call them doctor. When I vaccinated them today, the whole family had vaccinated. Thank you, doctor. it makes me feel good. It makes me feel good about what I'm doing, rather than giving a shot to someone who makes me feel like I'm obligated to give it to them because I work in a drugstore and I'm just a druggist. You see the difference? So it really makes me feel better. It makes me feel like I'm making a difference, and that's where it all starts. When the people and the community see us that way, government is gonna start seeing us that way. Corporate is gonna start seeing us that way. The white coat is gonna change.
Yeah, we're gonna get those extra 2 inches. So I asked you before where you think pharmacy is gonna be in 10 years, but where do you think you're gonna be in 10 years? In your personal experience, where do you think you're heading in your field?
You wanna hear something funny? A year ago, I was saying I'm retiring at age 35. That's it. I don't want to do pharmacy anymore. I don't see myself doing pharmacy. Growth is very slow and very limited to specific people in this field. But then I started looking into it more, and I started seeing all of these fields and how good I am and how good I can be, and improve myself and improve my skills and improve my knowledge, and how far I can get by improving myself. It's more challenging for pharmacists to grow than for other fields to grow, unfortunately. Let's talk about nursing. For a nurse to become a nurse manager, once they log in 2-3 years, they start asking them whether they want to be an assistant manager or a manager or a director. Why? Because if you show the signs that you're capable of performing the job, they just take you right away. In pharmacy, in a lot of the fields, unfortunately, when they see signs that you're capable of performing the job, they start taking advantage of you, make you do the job, right? With the same pay and the same title that you have right now,
Definitely.
and just not let you grow at all. And that's seen a lot in retail pharmacies. And it's also seen in hospitals. Just the chain of command is not correct when it comes to pharmacy. That the development of talented pharmacists doesn't exist. You don't have development programs, or you can barely find. I don't want to say you don't, because there is, but you can barely find any developmental programs for pharmacists to go from one step to the next. It's just locked on certain population. And also, this is something very common. It's locked on the people that know people. If you know someone, you're gonna get up there. If you don't know someone, you're just gonna stay where you are.
Do you think that actually what pharmacy school you graduate from and what connections you make there affect what job you're gonna have later on in your life?
Definitely.
Definitely, 100%.
100%. Because some pharmacies, the way they make their programs, and the way that the professors and the associate professors that teach there, they already have received a certain type of training. And because one professor was, let's say, a clinical pharmacist, he was able to hire another clinical pharmacist to teach a different subject. Let's say a critical care, knows someone in infectious disease, ID. They recommended them to do ID, so now you have clinical, and now just the tree is just getting bigger and bigger. It's all clinical. So from the training and the connections that you're making as a student, you're just being in the field of clinical pharmacy. There is not that much mix-up. I feel like as a student, you should get a cocktail of experiences, everything. You should get clinical pharmacy, you should get industry, you should get managed care, you should get engineering, just like we're talking, like computer science and informatics. If you know someone that did computer science and also a pharmacist and in the field of development of systems and computer programs, that would be a genius idea to have that person teach a class and prepare those students for the future. But because pharmacy schools are so limited to the groups of professors that they hire in the fields that they they have and they know, and the people that apply to this school based on who they know, you have limited knowledge given to the students, and that shapes what they want to do. If you look, let's talk about Rutgers University. From my knowledge, they have so many fellowship programs in the pharmaceutical industry with pharma companies. Their professors, many of them, and the connections and the people that do developmental programs there, they most of them work in the industry, and the fellowships are affiliated with the university. So as a result of that, many of their students are just geared toward pharma companies, and not many. I don't want to say a number because I don't know a number, but not as many do clinical pharmacy and go to hospital residencies versus what they do pharma.
Yeah, it makes sense because they don't have experience in that
Yeah.
field. Obviously, if you're told to, like from not a young age, but a young professional age,
Yeah.
which direction to go into, you're going to thrive in that profession and not know anything about
Yeah,
another.
same thing applies to where I went, to the LIU. Many of my classmates, they did residencies, only few did fellowships. Why? Because LIU, they teach, they have clubs, but these clubs are just not supported as much by the school. For myself, from a personal experience, I wanted to do managed care residency. Managed care wasn't a big thing, and the reason why I knew about managed care is because there was an opening in rotations in my 6 years of pharmacy, which is my last year, and they were looking to place me in a rotation, an elective rotation, not even a mandated one, an elective rotation, and they couldn't find any, so they sent me. I live in Staten Island in New York, and they sent me all the way to Queens to my elective rotations
Yeah.
because they didn't have a spot. And that's how I knew about managed care. That's how I learned about it. That's how I became interested.
Yeah.
They never even mentioned it in my class.
That's crazy. I think you said a lot of very good things today, but before we let you go, I want you to tell us one of the biggest things everyone's wondering, before the decision that everybody makes before they even go into pharmacy school. What made you personally want to join pharmacy?
Do you want the honest answer? Honest
Okay,
answer
honest.
is I saw many people go to my church, in my community, that are pharmacists, and they were all having this easy lifestyle. It was, they had weekends off, but that was back when pharmacy was luxurious. And they had good pay, okay lifestyle, have good jobs, very respected. But then when I went to pharmacy and I finished pharmacy toward the end, everything changed, and just it's not the same anymore. But like from when I went to pharmacy. So I liked pharmacy throughout school. I loved it. And I love it now too, but not to the extent that I want to do this for the rest of my life. I feel like I'll burn out really quickly. The quality of life is not the best because of all the workload that you get and all the stuff that get thrown at you and you have to react to on the fly. So that takes a lot of stress on you mentally and physically. So I don't feel like I would want to do pharmacy again if I ever go back to school. If I knew this information when I first started applying to school, I was gonna do medical school instead, because it was gonna be, yes, more years, yes, more stress, and every job comes with the stress, but at least you're getting higher incentive, more respect, and more potential for growth. So that was gonna make a lot more sense for the kind of life that I'm looking for.
Sweet. Thank you for coming on. You said a lot of very important things today that I think could help any pharmacy student in the field.
My pleasure.
Amazing having you on.
Thank you. Thank you so much for having me.